Hello, welcome everyone. We're going to go ahead and wait shortly to let folks join the session, but welcome to today's webinar. Before we get started, like I said, we'll give it a minute for folks to join, but thank you for being here. All right. All right, well, I think we'll go ahead and get started just for time's sake. Awesome. I do see more folks trickling in. Awesome. Okay. Well, welcome everyone. Welcome to the 2026 AI Cohort Series, brought to you by the California Telehealth Resource Center. We're glad you could join us for today's session titled AI Adoption and Readiness in Healthcare Settings. I am Jocelyn Jaime, Project Coordinator for CTRC, and I will be your moderator for this session. We'll go ahead and go to our disclaimer. Thank you. So this session is purely for informational purposes. CTRC has no relevant financial interest or arrangement with any organizations related to commercial products or services discussed during today's session. I will go over our Microsoft Team tips now. Before we begin, I'll go ahead and go over what is available to you. After speaking with our presenters for today, they really appreciate an engaging presentation. And so I think this is a great time to remind folks that of the resources you have available here. We are using Teams today, so feel free to open up that chat and use it. Let us know who you are, and then engage throughout the session when we're asking questions. You could always drop something in the chat. You could also raise your hand for reacting. At any point, like if we ask a question, feel free to raise your hand. You are also currently muted, but at any point, if we open up for dialogue, you're welcome to unmute yourself and share. And then as a reminder, this session is recorded. So today's session is recorded. Keep an eye out for any attendee announcements when recordings are available. So we will have this up in our YouTube at some point. So at any time, you can revisit this content and check out the recording. If you do encounter any issues, you're also welcome to email us at caltrc@ochin.org. For whatever reason, if you have any issues joining back the session, if you have any technical issues, I'll put that in the chat or email. Feel free to contact us. And we'll go ahead. Oh, awesome. I also want to thank our funders. The work of CTRC would not be possible without funding and support from the Health Resources and Services Administration's Office for the Advancement of Telehealth and the California State Office of Rural Health, part of the Department of Healthcare Access and Information. So thank you to our funders. Now to introduce our speakers for today. Awesome. I'm going to start with Buki. Buki, her name is Oyin Gansola, also known as Buki Ogurinde. She is a strategic transformation consultant at Ochin, where she helps healthcare organizations advance practice transformation through operational excellence and value-based care delivery. Her work spans Medicare strategy, population health, accountable care, performance improvement, and the adoption of innovative care delivery models that improve quality outcomes and organizational sustainability. A significant focus of Buki's current work centers on supporting health centers in the responsible adoption of artificial intelligence, which we'll be talking about today, for both clinical and operational applications. She leverages a people, process, and technology framework integrating change management principles to drive sustainable transformation. In this role, she also leads a multidisciplinary bench of AI subject matter experts who support health centers to build organizational readiness, strengthen capabilities, and accelerate innovation. She holds a bachelor's degree of science in biology with a minor in chemistry and a master's of health service administration. Welcome, Buki. Thank you so much for joining us. Now on to Liam. Liam Thornton is a program specialist at Ocean, specializing in clinician efficiency, provider well-being, and EHR optimization. As program owner of Epic Signal, he supports clinician efficiency data and workflow improvement efforts across the Ocean member network of federally qualified health centers. He partners with healthcare organizations to use data, workflow improvement, and emerging technologies to reduce administrative burden and improve the provider experience. Through a human-centered AI focus, Liam supports organizational AI readiness and adoption efforts, helping teams navigate change, build confidence in AI tools, which we'll do today, and realize measurable value from responsible AI implementation. His work helps health centers build the confidence and readiness needed to adopt AI in ways that support both clinicians and the patients they serve. He holds a bachelor's of science in public health management and policy, as well as a bachelor's of science in economics. Thank you both for being here. We really appreciate it. I'm looking forward to your session, and you have the floor.
Thank you so much, Jocelyn. Really appreciate it. Hello, everyone, wherever you may be calling from. Good afternoon, good morning, and thank you so much for joining us today. As was indicated earlier, this is a session that is titled AI Adoption and Readiness in Healthcare Setting, using the 8 key decision points for AI tool adoption. Again, my name is Oyinkansola Ogorinde. Feel free to call me Buki, just like Jocelyn said. And it's a pleasure to be joining you today. I do want to state off the bat that my passion is to help community health centers like yourself transform your organization with or through the responsible and safe adoption of AI. So I hope that this session will truly be facilitative and insightful in that regard. And of course, it is my pleasure to be presenting with Liam today, so I will hand it over to him to talk to us about today's agenda. Thank you.
Thank you, Buki, and thank you everyone for joining. Here is our agenda today and what we're going to cover. We're going to get into just, well, why does AI adoption matter and readiness matter? Getting into our framework that we're going to be really diving into today, which is from the Health AI Partnership, or HAIP. 8 key decision points. That's what's going to be grounding our discussion here today. And we're going to frame that in a framework of ask, guide, and illustrate. So really asking some of those questions, giving you a question to ask, guiding you through, well, what do you do? How do you dissect that? And then really illustrating, well, what does that look like in practice? Kind of doing some of that journey with you just to show how do you tackle all these 8 key decision points. And then we're going to wrap it up with some key takeaways, resources, and we're going to do our best to leave some time for discussion during the session and then also continue it in office hours. So let's go on to the next slide. Our goal for you today is just one learning objective. We want you to be able to take away and learn how to assess and pilot AI solutions, really with the goal to help drive adoption in those clinical and operational settings. So the one goal, the one takeaway, assess and pilot AI solutions, to make it simple into one tagline. All right, next slide. And I'll turn it over to Buki to set the groundwork of why are we here today.
Absolutely. Thank you so much, Liam, for that. Before we do dive into the framework and the agenda that Liam carefully outlined, I don't want to always talk. I like to talk about the, why readiness matters right now. Of course, we have been met with quite a bit of news, whether it's on our TV screens or even social media, but it's really important to always center why this is important and maybe why we should, we have to forge ahead when it comes to adopting AI in our work in healthcare. I'm sure it is not lost on any of you that there's a lot going on in our healthcare environment, right? We have real strains. And whether it's the aging population that have that will require more complex care in the future, just a complex environment to work in with our workforce shortages, and of course, just the burden that our clinicians are experiencing. Cost is climbing. We're trying to contain that, and of course, we have that disparities that has always actually occurred when it comes to our patients. And we're trying to manage all of this. We're trying to provide the best care to this diverse body of patient population and do so cost effectively. Hopefully, you can already appreciate how AI can play a role in this setting. So AI is not just this novelty, but it really is a genuine opportunity to work more efficiently, to make organizations much more sustainable and viable, and ultimately to deliver that value-based care and see those outcomes improve for the patients that we serve. Again, do want to be honest, I appreciate that this change is not frictionless. Lots are going on out there, even in our own communities, that we have to contend with. But I do want to say that this tension is exactly the reason why we have to stay engaged. And that's why engagement matters. If the people that are closest to the work, that's all of us, clinicians, non-clinicians, if we step back from these decisions, the future gets designed without our input. And if we stay at the table, then we get to help co-design it and insist that these tools be deployed safely and responsibly. So I hope that you all will embrace this journey, again, in spite of all the news that we have to contend with, and help to forge what this looks like for all of us in the future when it comes to serving our patients. So to that end, given the topic of the day, we'd like to ask you a quick question. Thank you so much, Jocelyn, for dropping that in the chat. Where do you see the greatest opportunity for AI to create value, either for you, your team, or your organization? If you can please just drop your responses in the chat, we'll give you a couple of minutes to do so. Where do you see those opportunities as you think about your organization and say, where can we leverage AI? Just wait for a few minutes for folks to respond. And you don't have to have full sentences, phrases, areas of focus. Terms like that would work as well. So just give you a few minutes there to let us know where do you see the greatest opportunities as you think about your organization or even your role specifically. Thank you so much, Calvin. You say innovative ways to use AI to help with administrative tasks. Yes, that is definitely a top of most people's list. Taking those tasks away so that we can focus on our patients is key. Pre-filling of patient forms outreach. Thank you so much. Krishanga, really appreciate that. And we have Eddie, revenue cycle management, referrals, in-basket management, absolutely all great areas for which AI could certainly be very, very useful. A couple more to come in. Epic implementation, PM, automation of redundant tasks, absolutely. Let's double tap on that. Data analysis for targeted support, absolutely. Identifying risk earlier in project planning. So that predictive analytics in many cases. Love that. Thank you so much, Kavish. Just going to wait for maybe a couple more just to see the diversity here. I see some themes, and I definitely appreciate the diversity of areas in which we could leverage AI. Building processes that can possibly expedite the process. Yes. Well, thank you all so much for sharing. Please keep it coming as you think about areas in your organization that you think, you know what, you could use AI here. In the interest of time, we will move to the next question, please. And that is, given all the ideas you've just added to the chat, and maybe the ones that you're still thinking about, what barriers or concerns would you need to address to be able to confidently adopt AI? So think about those barriers or concerns that maybe it's holding you back currently, or maybe you foresee, right? Or maybe that you think could be a hindrance to moving forward, perhaps with some of the areas that you've identified already. Just give folks a few minutes to respond as well. Thank you. Data sovereignty, yes. Data security and patient safety. You hit the triad there, Curtis. Thank you so much. Absolutely. Thank you. Misunderstanding and fear of AI. Thank you so much. And please forgive me. I'm going to say, well, Heidi, thank you so much for bringing this forward. This is where we have to really take account of the humans, right? We're the ones that have to work with this technology, and the misunderstanding and fear of AI is a real thing. Absolutely. As Jocelyn alluded to earlier in my bio, Liam and I do focus on the people, process, and technology framework, underscoring the people part. So important. Data sharing and storage of PHI are critical for our industry, that's for sure. Grace, privacy, security, structured governance, yes, transparency. We're going to touch on some of those things today. Thank you. Agree with everything that's been said. And I agree with Eddie as well. Barriers, okay. Data security, HIPAA, of course. All right. Thank you so much. Please keep those going. And again, this is the reason why we're holding this session. We hope that will help to begin, at least to address some of these items. I know we're not going to boil the ocean today, but this is that step that we all need to take to begin to address some of these barriers that you've identified. So thank you so much. I will turn it over to Liam to kind of start us out on the framework, and we'll kind of get this going. Thanks, Liam.
All right, so here is our guiding framework today when it comes to those 8 key decision points with AI adoption and what are those steps you're taking. Even though this shows it in procurement, development, and adaptation, clinical integration, lifecycle management, and it looks like kind of each distinguished step, kind of each kind of group, it's actually all going on at the same time. And we're going to emphasize that these are all kicking off, sometimes all at the same time, where you're having to do multiple of these at once. So we'll be calling and trying to tie that thread through. I also want to give the credit to the Health AI Partnership Network and group as well, who helped really create this framework. We're using this as our grounding framework because they did such a good job to kind of set it up. We're adding in a little bit more context, really getting into depth and talking through it. So if you want to check out more of their resources, to where we look, it's one of the groups we've really been able to learn a lot from as well. And we love sharing what we're looking at. So if you have suggestions, if you have groups you work with, or if you use their work, please share that in the chat, just because it's a community effort. As Bookie said, we're all trying to work through and learn this together. So we're going to cover each of these groups 1 through 8 and walk through that. So Bookie's going to kick us off with the first one on the next slide about how do we identify and prioritize a problem for possible AI solutions? What do you ask? What's the guidance? And how do we do that?
Absolutely. Thank you, Liam. So this is our first decision point, and that is to identify and prioritize a problem for possible AI solution. So this is where a lot of successful AI adoption starts, but also the unsuccessful ones, this is exactly where they could probably go wrong. Decision point 1, it's not about the technology. It is really about the problem. So before anyone does a demo of a tool or talks about the budget, you need clarity on what you're actually trying to fix, on what the problems are, and if it's worth fixing. Now, you all included a number of amazing, opportunities in the chat earlier, and as you can see, it's probably very recognizable. But again, you have to do your own due diligence in your health center as to what the problem is before you proceed. So the ask, and that is, what workflow is currently a challenge in your health center? I asked you about that earlier. That is the same question that you want to ask of yourself and your team as you choose or decide to move forward. It could be obvious, like some of the things you added in the chat, but also maybe not so obvious, but could be a root cause to other issues. And just it could be something that's just quietly eating away at your team's day. So when you think about all of those things, that is how you have to arrive again at what the problem is. And there's a number of ways to do that. One is to ask questions, right? Ask your team, get that feedback. Perhaps they've already lodged some complaints that you can look to, and some things you probably appreciate already. And of course, data is always king or queen, and you can certainly look to that to see if it points in a specific direction. So basically, identifying that problem and then prioritizing it. We cannot boil the ocean. We can only do so much, especially in the resource-constrained environment that we find ourselves as health centers. So it's really important to prioritize. And again, leaning into the data to see where can you make the biggest impact. And then, of course, once you do that, is you want to determine what are the dimensions of this problem. So if we resolve this particular problem, what would be the impact? Would it help? Would it be multi-pronged and help to address various sections? It maybe addresses cost effectiveness, addresses patient safety, and of course, clinician burden. You want to understand that full picture. It doesn't have to be anything exhaustive, but to appreciate for you to then make that next step. And of course, you also want to think about what are the sustainable technical approaches that you will have in place, right? Once you bring on this technology, the resources, the workflow, and then we'll get to explore some of that a little later. But more importantly is what is the potential downstream impact? I alluded to that earlier as you think about the dimensions of the problem, but do you start to see a downstream effect, hopefully positive one, from doing this work? Or if it's not going to be so positive, can we address that risk again or in advance of bringing in the tool? So I just want to say that these are some guidance for you to think about as you address the problem for which you're trying to adopt the AI tool to serve. So to make this more concrete, we're going to have an example shown throughout our session. And in this case, we're going to be focusing on chat review. So we'll go to the next slide, please. For this quick illustration, you can see it's a beautiful graphic. We have to be EHR agnostic for this presentation. But as you can see, I can literally ask you to picture the chat review process in a typical clinic day. And I bet you probably can appreciate what this face seems to be communicating. And I'm talking about not the ideal version, the real one, where you have a full schedule and there is simply no cushion or room. Of course, perhaps it could show up as really just time that you don't even have. It takes minutes to dig in per patient, to repeat all of this work across several appointments. And by the way, you're probably running late from the previous appointment, right? And you're trying to get all of this information, and you can imagine how this adds up over the week when it comes to, again, clinician burden, but also just the possibility of preparing for your patient and how that can impact patient satisfaction. Also, you may find that information is just scattered everywhere. You have this beautiful EHR, you go in there, but the labs are somewhere else, the images are somewhere else, the lab that was done externally hasn't come in yet, painting this amazing picture of what it could look like and what a clinician could be going through as they're trying to do something as simple as a chart review. And for me, much more important is really the opportunity that you may actually miss what's important and what matters the most to the patient. So to that end, we're going to use this as an example and hopefully speak to an AI tool that can help address this issue as we move forward. So to that end, I will turn it over to my colleague to talk about evaluating a viable component of the AI solution tool.
Yes, so this is the second part of that starting journey of really understanding your procurement. Like, what are you trying to find? And it's asking, well, what AI applications are out there? What's out there? Seeing that market scan, but also asking some of those deeper questions. And then, as someone just put into the chat, well, why AI is something that you need to start with and really assess and understand, because you're going to have a lot of opportunities to see a lot of solutions and opportunities. But first, starting with, is AI really solving what we're looking for? Could it be done in other ways? What is the technology doing? And understanding your problem will help inform you and really help direct that process of saying, well, AI will address this and it will be succeeding in what we're aiming to do. So you're doing that. Well, what's the role of AI? Is it automating for us? Is it doing some of the augmentation? Is it helping the human out? Or is it trying to predict, trying to pick up on patterns and really give some nudges before something happens? What are you having the AI do for you is really part of that. Also asking why, defining that, getting that clarity. You also have to do that work to look internally to see your readiness. And that's understanding, well, what resources do you have for adoption? Is it AI champions, IT teams, CTRC websites, those resource guides? Have you looked through that? What have you done to kind of set some of that starting foundation of, are people familiar with what is AI and how do you define it? It's asking some of those fundamental questions before you even dive into kind of what's out there, because you want to be able to have some of that starting literacy just to begin getting people to support. and it shouldn't be one team. And that's that number 3, where you have to really look at that. Hey, are we going to build or buy? But that's something you can't do on your own, and you shouldn't have one team do it. It shouldn't just be IT. It needs to be a variety of teams. It needs to be a variety of partnerships that are helping to inform and make those decisions. It's getting to a point where it's a little more accessible to potentially build something yourself using your own agent with Claude, or something that, like a small language model at your site. Like, the technology is getting a little more accessible, but why? Why are you choosing to do that? And do you have the resources? Do you have the team? And do you have the passion? Do you have the people who are wanting to champion that work? And if not, how do you develop that? How do you get there? And that's something to consider. Also, there's the legal dimensions, the quality dimensions, your investment. This is a lot of money to be considering when you're trying to either build or buy, partnering with a vendor, and especially with these technologies, the cost is only going to accelerate potentially with usage. And if you put it as part of your operation and your scale, it might grow. It also has that legal risk of, if you are choosing something that's fully automating your process, what's the risk? What's the liability? Have you reviewed it with your legal team? Have you reviewed it with your state laws and what might be coming? Is there going to be new requirements? Doing that full audit of your investment overall, of just saying, hey, if we do go down this pathway, what is the cost? How might it scale? How might it change? Where someone's going to build a solution within your EHR or something else, and why are we partnering with a vendor outside? And what's the value of that 1-year contract versus a 5-year contract versus a 3-year contract? Those are some of those hard questions you have to really dive into to understand all these decision points when evaluating. It is an intense process, and that's why we say is you don't have to lead it by yourself, or you should not. It should be that multidisciplinary team, which we'll get into. We have some of the toolkits for you to review today from CTRC. We have the AI tool as kind of the example, and then we'll talk about AI governance and how important it is for this step of just evaluating AI. So let's go on to the next slide. So you have resources as a part of the CTRC that you can access today by just clicking that link. There's a bunch of those toolkits. This helps give you a checklist and a starting point just to go down the list and say, yes, we've asked these questions. We've looked at these items. Oh, here is how we take this from a C-suite perspective. How do you set up some of that governance? A lot of good resources just to get started. And thank you, Jocelyn, as you're able to click that in the chat and pull that up just to see, well, what's out there. The next slide is just showing, well, here's your opportunity. Maybe you've done that research, you've really defined what you're looking for, and you find that AI vendor who has the chart review of tomorrow. It's a AI that is basically taking everything from your charts and making it into a nice little sidebar. A lot of them call them co-pilots, actually. A lot of vendors have solutions like this, where it's pulling everything into one concise summary. It's coding and giving some of the diagnosis support even before even talking to the patient, or pulling in the after visit context where, hey, we got these data points, so you might want to do this to sign your note. And it has all the traceable, audible information. You're able to track where did it pull it from the EHR, what was the context, you're able to update and change it, and it's not fully automated. So some of these might meet your criteria of saying, hey, we need to now implement this and do that. How do you do that? What's next? That's going to be on the next slide, where Bookie's going to preview where it should hopefully go to your data governance group or AI governance group. So Bookie.
Yes, absolutely. And thank you so much, Liam, for that illustration. Probably we're all getting excited with the possibility of the AI tool adoption. But yes, we have to make sure that we do our due diligence as we bring in this new tool. And of course, our illustration is this chart review tool. So let's talk about how you acquire that. And that is through governance. Governance isn't this policy binder that you pull together and sits on the shelf. It is actually a set of guardrails that lets you say yes to a tool with confidence. And that includes about 5 principles. It's transparency, it's accountability, it's fairness, privacy and security, as you can see, and of course, monitoring. So again, when it comes to transparency, you should be able to explain in plain language what the tool does. And of course, that should be surfaced, especially in your interaction with vendors. And again, as you try to answer all the questions that Liam just spoke to. Accountability. who owns the AI supported decision within your organization. And this is not just, an algorithm or a person or a role. It really has to be determined who has that oversight. There should be no ambiguity that can check and do their due diligence before you move forward with this AI tool. There's fairness, another item that should be incorporated into the evaluation of this tool, and that is to appreciate where is the model. And when we talk about model, we talk about the tool itself, because obviously these tools are operating on models. What kind of data were used to inform or create them? The historical data, are they closer to the patient population that you're serving so that they can be appropriate and not be brittle, as we call it in the AI world, or so that it doesn't drift too quickly? Again, basically ensuring that the AI tool is appropriate for the patient population to whom you are applying the tool. Privacy and security, we talked about, as some of you mentioned that in the chat, that is a real concern, especially in healthcare, because we are particularly sensitive to these areas. So are these tools HIPAA compliant? Do we know what they're doing with the patient data and even your data as users? And what does this mean, of course, in terms of training and supporting the models moving forward? And then there's monitoring. Again, monitoring the tools. I mentioned drift earlier, and that is where a tool no longer tends to apply to its application because it's dated or the model is dated. So as you monitor the tool, if you see something like that, then it's certainly time to reevaluate. Maybe it's just due for an upgrade or what we call optimization. So these are those elements of governance that you do want to have in place, again, before you move forward with a vetted tool, and something that should be incorporated as part of your vendor AI tool communications. And I know we'll talk about that a little later as well. So to that end, we do need to trust the tool. And the way that we do that to make sure that we're bringing in a trustworthy tool is to exercise governance. We'll go to the next slide, please, just to see what does that look like. Again, governance is not this thing that you just put on the shelf. It is really coming together to operationalize those elements. And there are myriad of ways in which that can be done. One is to form a governance committee. I know sometimes when we hear committee, we think it has to be these huge, key folks, and it's everyone right there. And you don't have the time or even the people to do it. Well, guess what? It doesn't have to be the case. It does have to be diverse. You do have to bring in those subject matter experts, clinical, non-clinical, IT, compliance. All of these individuals have to be at the table. However, again, it doesn't have to be this huge, heavy type of committee, but forming a body to whom, for whom they will have responsibility over your governance activities is critical. Of course, the policy, right? Having a policy in place that can provide the guidance that you need, again, as you walk through, first of all, how you bring in the tool, right? How you consider and evaluate tools, but also how your staff will use that tool. You need to have that governance policy or AI policy, to help shepherd that. And of course, there's those risk framework or risk assessment framework, as I like to refer to it, to which you will again use to evaluate the AI tools that you're bringing on. That dovetails right into the vendor checklist. Yes, and we'll talk about that later today. We'll show you a template, again, for the kind of questions that you can ask of your vendors as you're thinking about bringing this tool. Now, for what I think is the most important part, that is training. We're all learning about AI tools. There's a new one every day. We can barely keep up, but the fundamentals do not change. If you're bringing a tool in, it's important to create the space, the time for your staff to be conversant with the tool, to be trained on the tool, to know how to use the tool, also to be able to spot their own workflows and look for how they can even better apply the tool in addition to optimizing it. So these are some of those areas that you have to think about, still all under governance and practical steps to which you can take to ensure that you're doing just that. And I will turn it over to Leah to talk about measures of outcomes and successes of the AI solution. Thanks, Leah.
Thank you, Bookie. So you've gone through the process. You've done 1 and 2. You're now really looking at, okay, we're going to do this and we're going to deploy this AI. How do we start? First, start with your measures. Really define and try to dig into what is success and what outcomes measure that success. You need to really target and define based on the AI tool what that is. And that can be a variety of metrics. So if it's rev cycle, is it based on the volume of how fast is AI augmented? Is it the adoption? Are you just looking for people to use the tool? You want a variety of these metrics, and that's something you're AI governance team may really help drive and be one of their first priorities, really defining and understanding, well, what does success look like when we deploy that? And you may partner with your vendor. You may also just partner with a variety of people and be agile and do some of the work where you do a pre-post study. You do a smaller pilot, you do a 3-month pilot, you do a couple week pilot and see before and after what metrics are moving, what was the metrics of note. That will also give you some of that information you may be seeking by just trying it out, in small little changes will really help maybe illustrate some of those metrics you didn't even consider when you're starting this process. And this is not a one time we've done it and we're going to need to run with it. You need to revisit this a few times, and that's talked about a bit later as well. So what does that look like to revisit this? We also need to focus in on the successful use. It could be quality and it could be qualitative data and quantitative data. So both that hard data, both also that qualitative data of that feedback and experience, both for your users, both for the patients, also looking at data that is truly more kind of that log data or some of that context. So you're able to really have a variety of metrics, and you should use a variety of metrics to measure that success. And we have a couple opportunities with the class research, some log data, and then talking about AI tool feedback as one of those mechanisms. So let's go on to the next slide. One of the frameworks you could do this is using some of the world of research and groups, and the Class Arch Collaborative has a very strong framework where they basically survey thousands of providers each year across a variety of EHRs using a variety of technologies to understand what builds EHR satisfaction, what makes providers really find the EHR useful and meaningful. In that research, they found 3 pillars: shared ownership and involvement, education and training, meeting unique user needs. Those 3 pillars really relate to that EHR satisfaction after doing this survey with hundreds of thousands of clinicians, both in the US, but also globally. So this research is really kind of a good starting point to say, where should we look for AI tools, or what is success? Hey, we want to really make sure our pillars are being focused on. And you could use a framework like this where you use some of the research and use some of that context to say, this is the experience we're trying to create, where we really want them to have that shared ownership with AI, as well as feel like they were trained on it. And it's actually unique and personalized to them and their role, and not necessarily kind of a general use. All 3 of these could show up in your work as saying, this is what success looks like for us. The next slide, we'll talk more about more of that hard system data. What are you able to get out of the EHR? One of the things that a lot of EHRs require and have to have is the log data. And through research, the American Medical Informatics Association found 7 core measures of EHR use that impact clinician efficiency and satisfaction, looking at 3 groups: time with the patient, undivided time, where they're fully focused on the patient. There's not necessarily a screen in the way or doing that work in the EHR while they're talking. So that's super important. Time in the EHR in clinic. So that clinic work where they're having to do notes, orders, taking in messages for their in-basket or patient messages, and then time outside of the EHR. Are they logging in after their workday and having to wrap up notes? What work is keeping them lingering in the EHR and the system after hours? Those 3 pillars could also show up in your AI work, where you're digging into, hey, patient experience, time with the patient, time in the EHR when they're in clinic doing that work, and then do they feel like they have to log in after hours? And that's some of that insight you're able to start getting at and start using as whichever system, whichever way, you're able to use some of that data to really inform your work. On to the next slide. A lot of AI tools have this feature where it's real-time feedback. You're able to give a thumbs up, thumb down. This was great. This was not great. And you can give a comment, give that insight. A lot of tools have that as part of the option so the developers can really refine it, or you can get the results from the vendor or those tools to use that. That is a very good thing to start with the pilots if you're trying it out or trying to get some of that user feedback in real time. Socializing that, making sure that's part of that data that you're pulling in, can really help give you that user voice directly instead of you having to shadow observe, really try to watch them. Have them give you direct feedback where even the positives are very, very valuable. So you're able to pull from that. Ideally, you want to hear the pain points, but even encouraging like, hey, this is saving me time, making sure that that's something you're looking at and thinking about that comments and user experience. All right. So this is also me about just talking about designing new optimal workflow to facilitate integration. What should the new workload or workflow look like? Where do you begin? How do you develop that? First, it comes with just understanding what do you have? Understanding what does it currently look like? What's the current experience? You have to really understand that process, and it may be broken. You may realize that there's a pain point and it may be having a lot of friction. AI may help supercharge that and really help you redefine that and fix it, where you're now able to have AI help really patch it over and really make the workflow more optimized. But you shouldn't be doing this by yourself or with just a few people. It needs to have user feedback, user input. You have to do some of the tools where you make a process and journey map. What does it look like to go from just getting familiar to the workflow to fully adopting it and being a super user of that workflow? And how do you partner with people who've experienced it, are doing it every day, and really getting their voices into the process and being as detailed as possible? Don't let it grow beyond kind of the workflow and start trying to have AI solve the other solutions. You have to really keep that scope, really keep it focused in on that workflow just to facilitate the integration and being precise. With AI, it's very tempting to say, oh, AI could then do this next and do that next. You have to first get your foundational workflow and set that foundation. Then that's what enables you to scale and build that kind of adoption and do it. Because otherwise, if it's the workflow that's always evolving, always changing, because you're throwing more at it, it will just be the never-ending cycle of change, which you have to really manage and be deliberate with when it comes to this AI adoption and defining that workflow. And you have to be clear. You have to enable the implementation by setting and using some of those metrics you've defined, but also building the trainings, having the participants really have some voice in this deployment and hearing what do they need, what's going on, really having that alignment to say, hey, we can create this training or we can create that document. Hey, you like videos about it? We'll make a 30-second video for you. So you have to consider all these when you're looking at, well, what should it look like as a new workflow? On to the next slide. We just have this example of, hey, here's how you've changed your chart review process. And this is a very powerful way to also communicate the change and share, hey, here's the potential change and here's what you're getting out of it. It's that time saving. So today you're going through these steps where you open the chart, you're having to go through all the notes, you're chasing a bunch of other data points to try to document code, close things out. With AI, you pull up the pre-visit summary, it surfaces a bunch of things, you review, you check the link, say, oh yeah, this is pulling in from the latest note, it's pulling in that 3 months window that I like, and I do that, and then it's going to code. When I click the button, it pulls in what I've liked. I'm able to then review and then send it off. It's going to save this much time. It's one view, it's fewer misses. Here's what your new workflow will look like. And now let's train and do that. Doing something like this visual flow can really help with that. Well, where are we going from and to, which is a framework we really encourage that Bookie will talk a bit more about. All right, on to the next slide. And we're going to talk about, well, what is the safety and effectiveness of the tool? And this is another big point where it gets into a lot of questions, and it takes a lot of time that this may not be actually the step 5 that you truly do. You may have actually started this before step 1 or 2, or with step 1 and 2, because if you're very focused on that safety and effectiveness, you're having these conversations right in the beginning and even saying, well, why are we opening up that can of worms of AI and what that might be? This takes a lot of effort. There's a couple ways that you can do that. First is we'll talk about AI model carts. This is a tool that you're able to review that's like a nutritional label. There's a ton of them out there that are becoming the standard format that a lot of vendors and people use. And it's becoming a best practice to say, hey, give us your model card so we can see at a glance all these components. We're going to show you kind of what that looks like and where to find that or how to start with that. Bookie will cover that. We talk about the risk and liability of vendors because you need to know who you're partnering with, and especially with AI, your data is very, very valuable. And once you turn over the data, connect your data, or potentially open it up, to get that back will be a bit of a nightmare and a very, very long process to try to remediate or figure out, hey, you just used all my data to train something. Can you undo that? How do we manage that? Also knowing if they're at risk of being acquired by private equity, or if they have active lawsuits and other people who've brought that kind of court case forward. Know about your partners, partner with vendors who align with your values, partner with people who align with those ethics and responsible use that your organization has set up. Make sure to really stick with that. And that's something AI governance really can help you define and really set that guiding principle of what is responsible use. And that's key to also enable providers and your users to adopt the tool when they feel safe and assured of, here's what we have as our boundaries and our guiding principles, and here's what's safe. Also, really kind of work on that workflow design, validating the process. That's part of the safety. What are your gaps? What are your stop points? What are you putting in as controls to make sure things are not running automated and not necessarily being unchecked, keeping humans in the loop, not necessarily letting something run free. Plan for risk, plan for the worst, really set your plans. What is your protocol if something goes wrong, some data gets leaked or something is compromised? What do you do from there, and how do you manage it? How do you loop in the users, the patients, the vendor? What do you do? Make a plan. And as I mentioned, partner with your AI governance team. Partner with them and work with them on this process. It should be a team collaborative effort. And as someone said in the chat, it shouldn't just be IT. It should be clinicians. It should be operations. It should be even hopefully patients. If you're able to get some of the patient voices in, getting that holistic view will really help you capture all those dimensions that you need when it comes to this very important and very hard question of how do we mitigate and really use this technology safely and responsibly. It takes a lot of that internal work to really make sure it's aligning with your mission, values, and your patients. All right, we'll go on to the next slide. And I'll pass over to Bookie to talk a little bit more about just the vendor assessments, the questionnaires. What do you even need to ask and think about?
Thank you, Liam. And before I just touch on this collaterals, I just want to say that I'm seeing the chat. Thank you so much for everyone who's responding to some of the questions. This is about, learning from each other. So if you see a question and you just want to express what you're doing at your health center, please kindly address it. And of course, when we get to the Q&A, if we have time, we can entertain some of them, but great questions and responses in the chat. Do want to acknowledge that, especially around disclosure of the use of the AI tools to patients, which could be an entire webinar session on its own. But I do want to just quickly touch on this templates that we have is the AI vendor assessment and questionnaire that Liam alluded to. We will be providing you with this exact templates, but you do want to highlight, that one, they do exist. You may be interacting with an AI vendor, but may not know what questions to ask. These tools will help you do just that. And as you can see, we have the AI vendor assessment, which you should send to your AI vendor, have them completed, and it's really around the tools itself, the features and functionality, of course, data practices, as we talked about, the HIPAA compliance, regulatory compliance, if you will, as a whole, all the risk management elements that you see right before you. Again, we'll make this document available for you, and we ask that you please send this again to your vendor, and you can update it and, of course, enhance it. As Liam mentioned, there are many templates out there. This is just the one that we've used, and we continue to enhance it ourselves. And you can use that again to send to your vendor and have them give you some insights again about the tool that you're asking about. And then, of course, we have the questionnaire. Questionnaire is really one that you get to fill out in your health center as a team. And what you're doing is that you're checking the assessment, you've asked even clarifying questions, and you're trying to make a decision for the fit of that tool with your in your organization, and especially for the purposes for which you're inquiring about it in the first place. So I do want to just note that. I do want to point to the tip there, very important, just like with your governance committee, you really want to make sure that you talk to the subject matter experts to advise you properly on evaluating this tool. So you talk to the IT about security and safety, your data team about the data parts and the data sections or the data utilization, and of course, compliance with all the things that are regulatory. So you really do want to make sure that you have the right SMEs in the room to help you properly evaluate the tool along with evaluating the vendor as well. I also believe that CTRC has a wonderful AI guide. I believe it's on their website. It's part of the tools that we cited at the top of this presentation. Please check that out. It's a great guide, by the way, that you can also use and lean on as you think about interacting with your vendors. The next slide, please. I'm also going to touch on this very quickly because we do have this example of a template that will be shared with you. But as you can see, a model card, as Liam alluded to earlier, is really like a nutritional card, and there are many variants out there as well. It really just tells you about the underpinning model for the AI tool. So it gets a little more into the technical part, but also I call it the trust part. How do you know that this tool is appropriately trained, that it does apply for the patient population to which you would be using the tool, and that if it drifts or if it's brittle, that you do know about it ahead of time and of course even afterwards. So this is a great card to refer to. The goal here or the takeaway is to ask your vendors for these model cards. Ask them to give you these model cards and then have your team of experts review the various components to make sure that, again, that you have a good tool that will do what it professes to do. So I have just some key points there to ensure that you're able to integrate this, obviously, as part of the procurement process. And again, do it for all the tools. That way you can really compare, contrast and compare. Ensure transparency. Again, that's what using this model card is about being transparent about the tool. Standardize the internal use of it, as I said, across all vendors, across all tools that you use, consistently use it. And that way you begin to have a good feel, first of all, for the validity of the tool and really begin to understand the content with which that is enclosed within. And all of this, just what I said, really does help to build that trust and, of course, responsibility when it comes to using this tool consistently. So we will go actually to the next framework number here. I know we are coming up on time and I'm not really going to do a speed through, but I think this is something that we're all familiar with, and that is the concept of change management. When it comes to AI in particular, it goes beyond the technology. It has to include the people because we know change is tough, right? And change involves working with people, motivating people, really helping people to see the why, and of course, bringing them along the way. Whether they're early adopters, they're skeptics, they're cynics, or they just have a slower pace of adoption. All of those have to be acceptable. Our job is to bring folks along, and therefore, change management, when it comes to the integration of the workflow with your AI tool or to scaling throughout the entire organization, you really do need to employ a change management plan. And to that end is creating a communication plan that goes to all stakeholders. First of all, about your strategy to adopt AI in general, but really around even the tools that you're contemplating. To create an implementation of project activity plan. Again, if you've done any project and AI adoption is such, then you should have an implementation plan that can be used to manage the work. A pilot plan, right? You may not want to go full scale necessarily, but a couple of folks you want to get together, have them use this to do a pre and post measure of sorts, can be truly, truly informative and insightful. And of course, to create that ongoing change management plan, especially as you think about scaling out or getting this out to the entire organization. That brings us to the next slide, please. Basically, this is the pillar. This is a framework that we use at Ocean, and it's the prepare, mobilize, transform, really modeled after the ProSci pillars, if you will. But again, you can see it's really organizing those change management steps into the categories of preparation. You do have to prepare your organization for this work. That includes that readiness assessment that you may or may not have done, and there are many readiness assessment tools out there. Understanding your strategy and where you want to be in the future, because AI is going to be part of our future, quite frankly, whether we like it or not. So kind of being positioning ourselves and socializing that thought with our staff and bringing them along, and even patients is really critical. So along those lines, those are the steps that we have there. And then mobilize. This is really where the rubber meets the road. Can you get your staff to appreciate the reason why we're doing this, and of course, begin to adopt the tool at their own pace, and of course, in alignment with the organizational pace. And of course, we have that transform. This is where you're really beginning to see, you're monitoring the tools for sure, but you really begin to see the impact. Getting feedback, making enhancements, optimizing, and of course continuing to make improvements as you deem fit. So just wanted to put this out here. It's all about change management. It's all about the people. The technology cannot work by itself without people oversight, especially in healthcare. I do want to go to the next slide, please, just to touch a little bit on that communication piece. Like with anything in healthcare, if you don't get buy-in, it's not going to work. And I alluded to that as part of the change management tool, but it's really important that we provide clear and consistent communication about our goal, the vision, the mission, and of course, how this will impact the organization. So this conversation is very much needed. It doesn't have to be through the colored road glasses, if you will, but you do have to be realistic about, again, the pros and of course, what the journey could look like. So this is really the responsibility of the leaders to make sure that they're communicating to the team and bringing them along, demonstrating where are we right now? Why are we doing this? And what does the future hold? This is a great framework to help with that communication. And I'll just turn it over to Leah to talk about the monitor and maintaining the AI product. Thanks, Liam.
Yes. So now we're getting into the tail end of this, and you're probably picking up on that. A lot of these overlapping steps, and it gets into a lot of the same themes, but that's because this work is continuous and ongoing, and it's continuous change. And that's part of the challenge and part of the work of just managing that and really kind of mitigating like that fatigue, because when you get into monitoring and maintaining the AI products, it may start the whole cycle over where you're like, what are we measuring? Why are we measuring that? And then why did we do this? The goal of this, though, is really to say, where did we end up and how are we going to keep this being stable and how do we ensure performance? That's really the goal of monitoring and maintaining. You ask, well, how do we monitor and maintain of who, what, where, when? What are the related procedures and policies? It's really putting it into that programmatic structure of saying, we've done this, we've tried it out, we've piloted it, we've done all that stuff. Now let's cement it. And now how do we ensure it's part of our kind of operations and day-to-day and ensuring that people feel confident in using it? Monitoring AI involves looking at just that. Hallucination, drift, brittleness, all terms really focused on performance. Is it making errors with hallucinations? Is it drifting, going off kind of those averages and saying, is it starting to go in a direction where it keeps doing something that you are surprised by? Brittleness, when you deploy it in a new clinic or a new place, did it work right away? Or does it actually take a lot of work to set it up so it doesn't break? That's that kind of resiliency piece of the tool. You just need to also set up the mechanisms. So you may shift from more measuring kind of every kind of performance cycle or kind of like that pilot to how do you check at the end of day, the dashboard? Where are you looking at? And auditing, really digging deep, really doing the due diligence, whether it's every month, every year. How do you audit and ensure that the quality and performance is there and you're not having bad outcomes or unexpected outcomes? That's one of the key things that you need to do, but also ask your vendors, what do they do for that? And how do they support that? And what do they enable? Also, what are the risks? What are potential risks as this goes on for a year, 2 years, 3 years? If people start using that without even checking it and they're not being a human in the loop, what is that risk? As people mentioned in the chat, when it's deployed to the system and everyone has access to it, when people who are not the intended users use it, what's the risk? How do you mitigate that? How do you ensure that? Sustain improved outcomes, ensuring that it's growing or getting better is a other piece with these tools. In theory, it should get better over time and should be refined. It shouldn't degrade and go downhill. You need to actually hold it to a benchmark and then keep going on. And then gather your post-implementation data, really measure the impact and really show the success. And that's part of that change management. Show that change from to, hey, we went from this to this. Here's that impact. Here's the value we got. And that's part of that celebrating and really showing, hey, we've done this change and here's how it's saving you time. Here's how we're hopefully going to keep doing that. So let's go on to the next slide. I'm going to go over this pretty quickly, but feel free to review these slides of just here's how Epic EHR system does their development methodology. And you're able to learn from this of just, they use a use case research mindset where they first do a lot of research, partner deeply with end users, really understand the workflow. Then they develop a thought. How do they want to solve it using AI? Then they get a cross-role review. They get a variety of perspectives, challenging, pushing it, saying, is this right? Could this be pulling some risk? What's the bias here? And then they prototype. They iterate, they try a bunch of different versions, and then they go on to the monitoring, where they monitor success using data, operational outcomes, user feedback. That's how they develop and deploy their AI tools, which you're able to ask your vendors or your partners, or if you're building it in yourself or thinking about it, you can use this framework as well. On to the next slide. We also have their categories of performance. And I saw that was one of the questions in the chat as well, as just talking about that performance. What does that look like? And what do you need to monitor? You have a lot of categories, a lot of detail of model performance, software performance, clinical quality and effectiveness, usability, adoption, safety, security, business impact. It shows the amount of work that this is generating when you choose to start moving towards AI technology. It shows the amount of due diligence that's needed to really kind of cover all your bases and be responsible and saying, hey, if we're using this, here's all the things we need to track and be aware of and be thinking about, not just performance or business impact. It's all these dimensions that require that review and that partnership to dig into. So let's go on to the last step in our final piece, which is the life cycle. Updating, decommissioning the AI product. You're not going to maybe use the AI product forever. How did it work? Do we like it? Where are the pros? Where are the cons? Can it be optimized? Your contract's up. Do we want to keep using the tool, or are we going to look for a new solution? That's the endpoint to this overall process when it comes to just the tool. Your AI use may not end here, but this is going to be that decision you should ask and review as a group and ask, hey, was this worth it when we talk about experience and all that data we've gathered? Is it ready if we kept using it and used a new iteration? Or if we took it away, what would happen to that environment? What would happen to the workflows? And was it something worth scaling where, hey, we've done it in one department, and if we scaled it to every user and beyond, how does that scale nicely? Or does it not scale nicely where we have to wait in waves to put people into the tool? Is it really needed to be decommissioned, or could it be an update? Do you need to tune it and really just do some code development? And then minimize disruptions, really going back to that workflow piece and the change of if you used it for a year and took it away all of a sudden, how would that impact everyone? And really walking through that cost and effort to say, hey, we spent all this time integrating it, and if we pulled it out, how would people return back to the old workflow? Or what is even a newer workflow? And if you do a new AI tool, you begin this all over again, potentially, where you do all these steps. You may do it way faster, but it's still the same conversations you're having. So that leads us to the next slide, where it gives you just a sense of a life cycle. This is just a simple way just to visualize the, hey, we had that problem, design, we developed, validated, implemented, and then we did evaluation. This is a simpler kind of view of just, hey, if you were to do this for one AI tool, this is that quicker pathway, as I mentioned, of, hey, we've done this before, we really got this, we have our foundations of that AI adoption and readiness. Here's how we then do AI life cycles at our company. Similar to a data life cycle, you have to maintain them like a technology and really do the work to kind of always check and ask and say, hey, this is continuous, takes iterations. We have to kind of go between maybe that development and evaluation step a ton, and you may not do design as much, or you do hit that retirement or update phase and you have to then begin it again. So AI is not necessarily a technology you install and it's good to go forever. It's something you have to steward and really work on maintaining, growing, and using intentionally. It's not a simple process as much as we would like it to be. It's a kind of a whole shift in how we are working with the technology and how we're going to operate. But with that, we'll go into the next slide for Bookie to kind of wrap us up with some of the key takeaways and give us what to do next.
Absolutely. Thank you so much, Liam, for that. These are just the key takeaways. And as you can see, again, not to be too iterative, but it bears repeating. And that is that, we start with the problem, not the technology. It's always about let the problem drive the technology selection. This is indeed a team sport. I saw someone in the chat earlier, like, oh, it doesn't just rest on IT. And that individual is correct. This is really a team sport. It requires multiple subject matter expertise. We are in healthcare. We totally appreciate how that works. And all of those expertise need to be brought to bear to make this work. And of course, we have to think about the people, not just the tool. We have to build that muscle. And in this case, it's the people to make sure that we're upskilling appropriately and that we're training our staff to use this tool, but also to help us enhance the value of the tool. So some key takeaways for you there. In the next slide, and I know that we are probably into our office hours, so I may maybe just check with Jocelyn to see how we'd like to move forward. These were the questions that we had for discussion. However, I do want to say that these are even, this is a better question to take back to your team. As you review this framework, as you look at this model, ask your team, which part of this key framework or steps are the most challenging? And can we address them? Right? So that we can begin to employ, again, these key decision points and apply them to the tool adoption at our health centers. So I do want to pause here again, maybe to check with Jocelyn to see how we'd like to proceed. I see some questions in the chat as well, but we're open and available to support however we need to. So thank you. Thank you so much, Jocelyn.
Nice. Thank you so much. If you want to open up for discussion, that's totally okay, as long as you also, I want to be mindful of your time as well. So if you have the time, I love a dialogue. So if you have the time to open up the discussion, feel free to.
Actually, thank you so much, Jocelyn. I think it would be really cool to even address maybe some of the questions in the chat.
Yes.
And I know, Calvin, I love all the questions that you've been posing. So we want to hear from the members too, right? What are you doing? Because a lot of these things, they're very much dependent on your, health center, the resources that you have, the vendors you're dealing with, which are all varied. And we'd like to learn from each other. So I'm just trying to see if we can go up to see maybe some of the questions. And let's
Yes. Yes, and thank you, Calvin, for tackling some of those questions in the chat. So one of our first questions was from Krishanga. If to make outreach calls, is it preferred that AI identifies itself before conducting the call?
That is a great question. I do want to open the floor because I think some folks responded and I love the responses as well. So what are your thoughts? And then we can share with you some of kind of the prevailing best practices, if you will. I just want to level set it is around, again, patient consent, one, the disclosure, what does that look like? That's about integrity and trust. And then it's how you do it. Right? Someone put in there, which I thought was so, an AI, and I'm an AI tool. That's not how it's done. You can really introduce that AI tool, but much more eloquently and much more friendly. And then there's a concept of alternatives. Do the patient have a choice to not interact with that tool or can ask for a human person? So those are just some foundation, but I want to hear from folks. And by the way, Calvin, please feel free to jump in as well. Loved your questions you've been putting in the chat to get the conversation going. Would anyone like to share what their thoughts are? And Liam, please feel free to jump in as well with any other perspective you'd like to share on that question, which is very good.
To get us started, I'll go ahead. Oh, Krishanga, go ahead.
Yeah,
go ahead.
Okay, go ahead.
Hi, sorry. I just wanted to add a little thing that happened and for everyone's context. So we were testing this AI model out for outreach calls and we actually spoke to the model. We were testing it out and we asked, are you an AI model or are you an AI agent? And it said, no, I'm a person in the care team. And it kept saying that. So that's when things were like, okay, AI is telling I'm a person and it sounds very real. It was pretty personified. It had background noise, so they worked it pretty well. But then it kept saying that I'm a person. So that got me to wonder, should we always ask AI to identify itself as, hey, I'm an AI agent or an automated assistant, and I'm going to help you out today with this. So just giving a little background.
Thank you so much,
Yeah, the
Krishanga,
last
for
thing
that
you want to
insight.
do is gaslight your patients, right? I mean, like, for the love of Pete, like, if you're using an automated tool, just let people know. Like,
Thank you so much, Krishanga.
Go ahead, please.
Go ahead, Buki.
No, I was just going to say, I agree, Calvin, with what you said. And Krishanga, thank you for sharing that. We have to respect our patients. And let's be honest, they know. When that comes out, we all do. We all know we are talking to a bot, and we all have these experiences, right? Very relatable. But again, we can be much more eloquent with this presentation. They can present themselves as assisting the health center. I mean, there are different scripts that you can, and of course, the model also getting better. They're sounding much more human-like. Not to say that we should still be deceiving or we intend to deceive our patients. We should disclose, and then have the patient hopefully have it bring the efficiency and the quality that the patient should be getting out of it. Because if it's not providing quality to your patients, I suggest you move back to human very quickly. Again, that seems anti-AI, but we should not put technology out there that keeps the patient going in circles. And again, when it comes to alternative, really important. If always have that option, at least until we're all fully socialized, to be able to allow that patient to seek or talk to someone else if they feel that their needs are not being met. It's really important. A patient cannot be on the phone, doing a dance with AI tool and not get to who they need to speak to. But Emilia, I see your hands up, and I don't know, again, Liam, if you want to add anything, and Jocelyn as well, but thank you.
Yeah, thanks, Bookie. And I just wanted to respond to Krishanga. I think reporting that back to the vendor is really important because what's concerning to me is patient consent here. If the patient is not being given accurate information, a consent is not viable at that point. It's not valid because they're not consenting to what they're actually consenting to. So there's a little bit of a major liability concern with that. And that liability does fall on the organization, essentially, not the vendor. So I think once that's identified is absolutely engaging the vendor and letting them know what these concerns are and bringing up the idea of consent, especially if you're in California. California has very particular consent laws that are unique to other states. And so, again, just worried about the risk of liability there.
Yeah, thank you so much for sharing. I think that's a great example of we can't just assume that, allow AI to kind of do that. That's a great example of like, we just don't, maybe we might have not thought of AI being able to do that. So thank you for that great example. I think something that people also noted is that it also depends on your audience when it comes to your script and what you want to let folks know and disclose. I think that's very important. Consider who you're talking to. And then, like Emilia mentioned, thank you so much, is like the conversation doesn't end with your vendor when you just adopt your AI. It's an ongoing conversation, and especially with your team. So thank you so much for sharing that. We do have another question in the chat from Curtis. Or before we move on, any other comments on that? No, okay, I would definitely want to get to this next question. So I'm curious how other organizations have, this is from Curtis, by the way. Thank you, Curtis. I'm curious how other organizations have thought about handling the difficulties that come with the ubiquity of AI tools across clinical roles and the blurring lines that can occur with role-based access. Oftentimes, organizations have to make compromises on what access and permission roles have, especially if they don't directly own the roles, and which staff are assigned them to complete their job duties. What would be the best ways to handle those edge cases where staff are non-clinical, but they are included in a role that has access to AI tools or assistance designs for employees with clinical licensure? Very good question. Thank you, Curtis. I'll open it up, whoever wants to answer the question.
Any thoughts at all for how you've handled those in your health centers? Curtis, how are you? I think your question may have alluded to that, but how are you currently addressing this? Are you much more conservative in the approach, or how are you making this determination? If you'd like to come off mute, or if you wanted to put in the chat. And what I will say as you're thinking about that, and Curtis, please feel free to come off mute if you will, because again, these are they're very across organization. But I do always ask folks to draw the parallel between how you provide access to members of your team currently, right? We know the rules about obviously the HIPAA compliant rule part of this, but also it really should be related to your job or the role that you serve. So while there may be cross, functionality with the tool, then maybe that's an indicator that that person has the appropriate access, even if they may not be the primary user of the tool. And of course, you have other monitoring mechanism in place, including looking at the access data, utilization data on the back end. But just wanted to see, thank you so much, Curtis, if you could expand a little bit on what you're doing, and we can go from there.
Yeah, thank you. The reason I had asked is because we're actually still very much trying to figure it out. We recently discovered that there were some tools already providing written drafts in response to patient questions that were coming across through like their patient portal. And we have identified that not all of the responses are coming from clinical staff, and that there was some language in those drafts that were very on the edge of what is a clinical response to a patient versus what is just a staffing response to an inquiry about appointments or scheduling. And so I was just curious how other organizations are thinking about these potential concerns, because we have a lot of staff who are in positions that require them to have elevated permissions over a typical front desk role. And so they end up in positions with more access than maybe we're comfortable with, but we are limited by the vendor in those different options to choose from. And so I'm just curious how other organizations handle this, because there's a lot of questions we have, and we're doing the best we can to kind of brainstorm about it. But, I'm always looking for different perspectives on how to handle this stuff.
So just a word of advice there. I'm just going to hop in. You're paying your vendor money, correct? So at that point, if their tool is not fitting your use case, then maybe we need to go back to the definition phase and define like who has access to platforms, and again, that's that closing part of that loop of as far as your tool evaluation, and making sure that okay, we've got this deployed, and now here's some unintended side use cases that have popped up, or unintended people have access, or whatever, and so that goes back to your evaluation phase. And if you're not looping that vendor, or if the vendor is unwilling to receive feedback and come to the table with you to work on a solution, maybe they're not the best partner.
That's a well articulated response, and it raises another question in my mind, which is, from your perspective, do you think it would be better to try and install guardrails on the tool itself, or to use these examples as a way of getting the vendor to include or create more nuanced roles? And I'm sure some of that is going to be, whether or not the code is even capable, right? Can they adjust these things? What options are feasible from their side? But I'd be curious about your thoughts on that.
I'll add to what Kelvin just mentioned, and what Bookie just added in the chat is all of the above. But Curtis, I've been in your situation, in that sometimes you can work with your vendor's just not able to evolve as quickly as the technology is available. And so what I've done at a previous organization is, while we're working with the vendor, it's training and communication to the staff that are utilizing these tools. It's letting them know what is within scope, what is not within scope, how to differentiate the two, and how to then communicate that with patients. And sometimes that is what you do, what you can do. It of course, takes additional effort to have to design workflows around the limitations of, and really, I mean, we're talking AI today, but that's technology in general. This has been an ongoing discussion with like things about, you know, EMR access and who can see what parts of the chart, and, you know, like it's taking the same idea and then depending on new technologies, we're having it in different contexts. But I think it's both. Again, all of the above, what Bookie mentioned is, yes, there should be different user roles, and that's going to take time to develop. And user roles will also evolve over time. So that's going to be just an ongoing conversation as we move on. But in the meantime, definitely working with folks who understand that AI may give them more information than should be shared, or AI may give you even incorrect information, and how to discern between what should be shared and what, you know, how to identify if something's incorrect. It's that communication that I think will prevent a lot of errors, whether that's too much information or incorrect information. Staff training is really vital, a vital element in this entire equation.
Ross,
just
yeah, Calvin, I'm so sorry. Go
And
ahead.
just a follow-up word there, you know, with the growth of these AI models, we're seeing generally in the industry, we're seeing a larger portion of what are traditionally tech firms trying to enter into the medical space. And a lot of these organizations or these vendors don't necessarily have the medical use case down. They have a really cool tool and they have some data sets that they've modeled that, and now they think it can make money. And so that doesn't necessarily mean that they're going to be the greatest partner out of the gate. So there again, going back to your governance committee, doing that due diligence is critical.
One of the things I wanted to add to this discussion as well is on that cultural piece and empowering users, building that literacy is developing the sense of AI taste is how I frame it, where what's good use, what's bad use. So with generative AI, that's a great example with LLMs of how they can make something sound very fluffy and good, but then copy and paste that and put that to a patient. That's not good taste. It's like having this distinction. It's a lot of work to try to tease that out and teach that into the culture, but it's very, very important when it gets into literacy, where if a user gets an AI tool in front of them, they can do that. Okay, this is a good use case where it's kind of in good taste, or it's not good taste, where it's fully taking out some of that decision making or not really getting what's needed. Building that taste is very, very important. And it's part of that challenge of change management and getting people to start adopting this technology. I equate it to also like good PowerPoints versus bad PowerPoints, having a ton of cheesy transitions to like the ones that are a little clear and concise. That's kind of how it works with the technology. It's just building your taste with AI. And it's both a personal skill and a general skill, where people also feel that with emails. You can tell sometimes when you get those AI emails, and I've gotten them where you're like, really? They didn't put a little more, an extra prompt or two to make it a little more human. People can relate to that, saying, develop your taste, try to use it in good taste, and have that be like kind of that phrase you could use has been something that has helped. I work with members that's helped stick for their staff, and they've developed it into their campaign of like, hey, one of our goals is to have you have good taste with AI. You're going to have a lot of options out there. Some of that you can use with good taste pretty easily. Some take a little bit more time. You have to kind of be an artist where you get to put that in and kind of add your flair. Don't have the tool fully do it. You still have that role. And it makes people a little more engaged instead of just saying, that's bad AI use. Taste is a little bit more fun.
This is Bookie. Not to belabor the point. Thank you so much, Curtis, for this question. I do want to say, though, kudos to you for even doing the audit work to even surface these things, because that's part of what it is to monitor this tool, right? Change takes time. So there's that. Two, again, you're bringing a tool into a space where, by the way, these models continue to learn, right? So you're bound to catch some of this, these elements that you just described. And quite frankly, as you make changes to them, and I don't know what kind of tool you have, those models, again, are learning. And therefore, they're adopting to the change. I know you're talking about role-specific, Curtis, so I see where you're coming from there. And that is something, again, to take back to the vendor. But kudos to you to continue to do those audits. And the more of those issues or use cases you're able to surface, that also compels them to act, right? And I think that dovetails to maybe the next question. Thank you so much, Calvin, for dropping that in the chat, which is all of these conversations really should be part of your vendor conversations from the beginning. Right, what does it look like when it comes to model enhancement, optimization, when things are hallucinating or they're drifting? How do we address that? How do we decommission it in the interim or much more permanently? And what does that partnership look like when it comes to the horizon? So I just want to emphasize that, but again, kudos to you for doing that audit and monitoring, so important. And then I think, again, that dovetails into the next question. I think that Calvin, I don't know if you opened it up to members to respond to, but just wanted to highlight that.
Thank you all so much. Due to time, well, if anyone actually has any last questions, feel free to add them to the chat. And we have great people here with us that have been so helpful and have that experience. So if you have any additional questions that we didn't get to today, please feel free to add them to the chat and we will go ahead and make sure we get back to you. But any last notes or comments before we transition to our wrap up? No. All right. Thank you so much again to our speakers. Please again, give a virtual round of applause to our presenters for today. And thank you, Calvin from TTAC, who joined us for the last discussion and helped us to also answer some of those questions throughout. Thank you all for your engagement. If you have any additional questions, again, you could paste them in the chat. We also have the contacts here available for our presenters for today. Thank you, Buki and Liam, for joining us. We greatly appreciate it. We'll go ahead and go on to the next slide because we want to hear from you. Let us know how we did today. Please let us know by answering our survey. I'll go ahead and launch it in the chat shortly, but let us know how we did. We love to hear from you. This way it helps us for future presentations and also gives us insight on what you learned today. So it's loading up, so you should see it pop up in the chat in a second. There we go. It was slow for a second. You should all see it now. So please let us know how we did. Let our speakers know how they did today. We really appreciate it and want to hear from you. And thank you, Claudia. Claudia has been supporting us with the slides. So thank you for being here today with us as well. On to the next slide. As you respond to our survey, we want to let you know that CTRC is here to provide ongoing support. We offer amazing events like this today. We invite speakers to provide their expertise so that you can learn, so you can continue your learning. So join our webinars, visit our website to continue learning about our future events. I'll go ahead and add it to the chat here. CalTRC.org. We can visit our future events. And then, sorry, we're wrapping up. This is where you can also contact us and stay connected. You can sign up for our newsletter. We're also on LinkedIn. That is where we always announce a lot of our events, our registrations for future webinars. So please stay connected. This session was also recorded, so all materials, as promised, will be available on that website here. You can scan the QR code. Within the next week, all the resources for every session will be available. We also have a webinar tomorrow as well. You can visit the website to learn more and register for that as well. And we officially finished our office hours, so we're good there. Thank you all again. Really appreciate it. A last round of applause, and thank you to those who responded. Thank you, everyone, for being here. I'll
Thank you,
leave this
CTRC.
Thank you. I'll leave this open in case anyone wants to is still responding to our survey. But thank you, Buki, thank you, Liam and Calvin, for being with us today. Your expertise is greatly appreciated, and all the resources you were provided were so helpful. Everyone is free to go. Thank you all. Have a great day.
Thank you.
Bye.